I'm like, well, actually, I just sat in a meeting. I can tell you they will be in 3 years.
Mhm.
I do. I'm an alternate for Pinellas. I have never had to do it. I'm the main for Pasco, main for Hillsborough, and I'll also do Sarasota.
That's right.
Yeah. Right. I didn't know there was all of my responsibility was doing stuff like accounting.
I was
Yeah. Yeah.
and that's okay.
Yeah, they're all private. Their meetings are like lightning fast. There's nothing to talk about. I'm all you want. You know, bring your food. Lots of buses or whatever.
Right.
Very nice.
And I guess it brought me to
It's really good, yeah. Yeah. Well, it's nice to meet you. Oh, you here every.
oh, no, yeah.
Okay.
Yes,
Yeah. One of our
right.
exactly. It's good. Yeah. I've learned all the odds. I'm not having forwards.
There's a few I've run into.
I don't think
Oh, okay.
Yeah.
We're not doing that. So I'd love to see it succeed because I mean
Why live, you know, in the middle of all this stuff? You know?
we've actually
don't have enough downtown to make it. Giant bus.
Somebody called me and I'll meet with them.
I didn't know.
Okay. 3 months ago.
I know.
Yeah, he's still there.
I don't
Couple
know.
hours, look at it.
It's more or less like little application. There's someone on the pickup and someone claim it.
Well, that happens.
Do we have a form? I can't hear you. You what? That's exciting. We're gonna do the workshop first. I said, is that what we're doing? The workshop? But we can get started on things we can't do is anything that's an action item. We'll have to wait. You ready to get started? Oh, there you go. Now we're on. Okay. Good morning, everyone. I would like to call to order the hybrid virtual transportation disadvantaged local coordinating board of the Metropolitan Planning Organization workshop of May 27th, 2021. I'd like to remind everyone to please silence all electronic devices, and for those who are attending virtually, mute your microphones while not speaking. At this time, I'd like to ask everyone to stand for the invocation and the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Clerk, would you please call the roll?
Napier,
Present.
Dave Newell, Joe D. Domenico, represented by Jody Armstrong. Here. Michael Mahoney, Rebecca Wilkinson Shields, Chrissy Seacone, Jason Martino, Catherine Seksevsky, Sherry Cook, Damian Barnes, Emily Hugart,
Present. Mike Lacey,
Present.
Jose Mendoza, represented by Ms. Maria Reza, present. Diane Elrod, Diane Elrod, Chairman Ron Oakley.
Aye, here. I don't know if that gives quorum. It doesn't sound like. I mean, we short for quorum.
We do not. Can you hear me? Okay, we do not have quorum at this time.
Okay. All right, so today, of course, we're in the workshop. Today we have one item for public hearing. Item A, presentation of the Transportation Disadvantage Program.
For clarification, Diane Elrod is on the line, virtual.
Yes, I am
Clarification.
present virtually.
Morning.
It's not on.
Can you hear me?
Yeah, I hear you now.
Okay. Morning, everyone. My name is Tania Gorman, Principal Transportation Planner with the Pasco MPO, and we are having a public workshop to go over the Transportation Disadvantage Program here in Pasco County and to review the Commission for Transportation Disadvantage, how the program works for our local coordinating board. And I'm going to go through my presentation at this time. So currently, Florida law establishes that we have a transportation disadvantage program. We have an administrative code that helps this program to function with specific rules and regulations and requirements that governs this process. The Commission for Transportation Disadvantage has a state commission with agency staff. We all know that. We call Sherry all the time in Tallahassee. Was created in 1989. It accomplishes the coordination of transportation services provided to the transportation disadvantage. The commission is made up of 5 members who have significant business operations experience, 2 members that having a disability and using the TD system, 8 ex officio non-voting advisors, Secretary of Transportation, Secretary of Children and Families, and a Director of Workforce Innovation. And then we have some other members, of course, Director of Veterans Affairs, Department of Elder Affairs, and we have a county manager appointed by the governor himself. Definition of transportation disadvantaged. Those persons who, because of physical or mental disability, income status, or age, are unable to transport themselves or purchase transportation. A TD person needs assistance to obtain health, care, employment, education, shopping, social activities, and other life-sustaining trips. And then we have our local coordinating board, which we have here today. It's comprised of citizens, representatives, governmental agencies, purchasing agencies, non-for-profits, and service providers. Our current local coordinating board is made up of 16 members. Our current chair is an elected official and is appointed, all the members are appointed by the official planning agency, which is the Pasco MPO. And we have quite a few members, as you all can see on the email list. It's comprised of so many members in our community. I have them all listed on the slide if you'd like to go through them. The Community Transportation Coordinator, the CTC, is responsible for the arrangement of delivery of transportation services. So our current CTC is Pasco County Public Transportation, which the Executive Director is Kurt Scheibel. The CTC may provide a sole source or partial brokerage or complete brokerage services. So currently, like I said, that is Pasco County Public Transportation. The official planning agency, as governed by law, is the MPO. Most of the time, it is an MPO. Usually, the CTD recommends it is an MPO. If there's no MPO, then they move to the next transit or other agency that they recommend. Authority of the Commission of the Transportation Disadvantage. The CTD is an independent agency. However, it is it is held or housed within the FDOT. It is not governed by FDOT. It's there for administrative purposes, kind of like how the MPOs function in a way within the county, within the regional planning councils, same kind of function. In fiscal year 2018-2019, the Florida Coordinated Transportation System reported revenues of $301 million, which generated 21.1 million trips for over 280,000 people. The CTD administrators the Transportation Disadvantaged Trust Fund. So it does quite a bit of work for Florida and its transportation disadvantaged. This every year the commission comes out with the annual report. If you don't go on the website very often, it's very informative. It taught me a lot. They have an annual report. I'm sure it's coming out soon. And you can go in there and see how much they spend for everything. And this is the pie chart that is presented. And it tells you how much of that almost $66 million, where they've spent it, how they spent it. And it's very informative. And you can see it's FDOT Walk Grant, some of the funds, FDOT Trust Fund, and the pie chart breaks out all the funding over the state. The duties of the Commission of the Transportation Disadvantaged. So what do? Develops policies and procedures for the coordination of transportation services for the transportation disadvantaged, designates the planning agencies in areas outside the purview of the MPO, approves the appointments of CTCs, and contracts with CTCs. So I think about the CTD being like the top of the triangle, and then the CTD tells the CTCs and the planning agencies kind of what to do. And we kind of branch off and we get our marching orders, and then we work together to give the services to the transportation disadvantaged. So this is Pasco County's kind of a not rough estimate, but it's kind of just outlines a really quick sketch of how we operate here in Pasco County. The top portion is the planning agency, so the Transportation Disadvantaged Fund. So this year we received $30,035 for our planning efforts for this board, because we're the planning agency. That's why it's imperative we have quorum, because our billing is based on us coming here and making that vote. And then on the other side of that, we have PCPT, which receives FTA funding, as you can see with the trip and equipment grant, which is quite a bit of money to help along with those services. And then we have the 5310, which is Enhanced Mobility of Seniors and Individuals with Disabilities Program. And then we have the 5311, which is the grants for rural areas. So there's quite a bit of funding that goes into making this TD program work. And this is just the TD program side, but the MPO is not limited to just those kind of funds. We do have another side. We have called PL funding, and we do have transit funding, but it's allocated to another portion of our program. And then we have the Commission for Transportation Disadvantaged reports. So annual performance reports. So every year, if you've been on this board long enough, we come before you and we say, hey, we need you to approve our AOR. And our PCPT director brings it before you. He'll bring it before you later today, and he'll provide a comprehensive report about all the services he's provided with some of the companies he's contracted with to provide these services as a CTC. And so I took a little bit of a screenshot to provide his latest AOR. It tells the trips by trips of service. It tells you the population of Pasco County. It tells you the trips by provider, financial and general data. It gives you a really great snapshot of what he's provided. And here's a little org chart. I did this org chart. It was a little bit more simple. It was a little simpler to kind of break down. As you can see, the CTD is on top, and then they go out to the designated planning agency, then it goes to the local coordinating board, then to the CTC, the transit operator providers, and it keeps going down, and we all work together. So why is the coordination worth the effort? I know a lot of us that work as local officials or public servants, we go home at night and we're like, wow, oh my gosh, I'm so exhausted. I really was, in it to help, and I thought I'm helping, and I wanted to help more people. Well, we do. Sometimes we don't see it up front, but we do help a lot of people. And we have to keep at it every day to ensure that we continue, because sometimes that 1 affects 2, and that 2 affects 5, and that 5 affects 10. So it's just a snowball effect, right? I went too far back. And so we continue to do that because it involves strategies that involve more trips. Coordination produces services that is cost effective and efficient, reduces fragmentation and duplication of services. Coordination increases utilization and ridership. I came here in 2018, and I can say since coming here, growing professionally, I've watched, PCPT, TBARTA, they've done great programs that has increased ridership, that has increased better service. So we just have to keep on going and watching and growing. And with all the latest technology and our smartphones, we'll continue to make it better, right? So, government in the sunshine, and I'm not talking about the Sunshine State. We all love our Sunshine State. I'm talking about the Sunshine Laws. As members, we can't all congregate and talk about things on our board. We have to make sure that we keep strict adherence to we do what we do here. We're not talking about it, while we're at lunch or getting our hair cut or nails cut or at a friend's house. I know it seems like it's so simple, but that's how the smallest of things and things get in the paper. And so that's why the Sunshine Laws are here, to protect you, to protect the citizens, to protect all of us. It applies to all functions of covered boards and commissions, whether formal and informal. It even applies to our citizens advisory committees. I'm sure some of you all sit on other boards. I'm sure you've heard of this. Conflicts of interest. LCB members should be trained and comply with requirements of certain laws that, of course, we don't want to be on boards. We sit with friends or families and things of that nature. And of course, every year about this time, probably the next couple of weeks, Tallahassee will distribute to us our actual grant agreement. And we'll have a list of tasks that we have to perform in order to receive funding as the planning agency, and these are the tasks. And as you can tell, we have 4 meetings a year. We have a CTC evaluation, which I'll bring to you later. We have a TDSP update, which again, I'll bring to you later. The AOR will come before you, the grievance procedures, and any other grant applications and reports that are applicable. Thank you for your time. Any questions, comments, concerns?
Any questions?
Thank you.
Dan? If there's not any questions, then that concludes the workshop. So, nothing to vote on today. Well, you wouldn't vote in the workshop anyway. So, okay, we'll move from the workshop right into our regular meeting. We've already.
We have to adjourn the
Oh, excuse me. We adjourn the workshop and we begin the regular meeting for. Let's see here. Okay, good morning. I would like to call to order the hybrid virtual transportation disadvantaged local board meeting of Metropolitan Organization and meeting of May 27th, 2021. I would like to remind everyone to silence their electronic devices and everyone attending virtually mute your microphones while not speaking. Okay, we've already had the Pledge of Allegiance and the invocation. Okay. It says for approval of minutes, and we do not have a form to approve the minutes, so we'll pass that at this time.
You can just present the items, go through the items. We can still present the items, and you guys can hear. Can you hear me?
I don't know if your microphone's on or not.
We can just present the items and
Okay, that'll be fine. And of course, it has.
Move into the Community Transportation Coordinator AOR report from Kurt Scheibel.
Okay, welcome, Kurt.
Good day, sir. Good day, board. Kurt Scheibel, Director, Pasco County Public Transportation, and also the CTC for Pasco County. Pardon me. So, as you know, COVID affected a lot of transportation over the last year. So just to kind of give you some rundown on the numbers, we had about a 57% drop in rides for both the CTCs and for the coordinated contractor. For us alone, though, we saw a really sharp drop in the number of non-ambulatory folks, i.e. people in wheelchairs, which is understandable because normally they are the ones that are most concerned about catching COVID and would probably have a bigger effect on them due to whatever concerns they may have. So we have been experiencing that. It's been pretty steady from 2 years ago to this last reporting period. We're getting ready to report again on our next year. I expect the numbers to be about the same as what they reported last year, even though there was a couple of months where we were pretty much normal during that time period. Other than that, not many other things really stood out as I should say noteworthy. It just seemed like a pretty good, solid year. I will say though that even with all these numbers, and when you look at the numbers overall, I think we are actually doing relatively well compared to some other organizations in Florida and around the state. I'm sorry, Florida around the state. That's really good English, isn't it? I mean, around the country. The things I've been reading is a lot of people were 50, 60, 70%. We only got down to about 30% on the fixed route side, about 50% on the paratransit side. We're starting to see those numbers slowly creep back up as the vaccines start rolling out and people start getting a more, not comfortable is the word I'm saying, but are educated more on what actually COVID is and how it affects and what you can do for yourself to protect yourself and your family. So beyond that, any questions?
Kurt, did you start any new routes during this time?
We started one in October of last year. It won't be on the report that I'm briefing now, be on the next report,
Okay.
the 20 route. The problem we had is we have a lot of routes up and down. And unfortunately, the 41, we have not even restarted back up just due to very, very low ridership.
Right.
It's the cost per rider and the low ridership just does not warrant bringing it back. And we've had literally zero complaints. And we're really looking hard at the 31 route right here and moving from maybe a fixed routes system to a more of a micro transit solution where we'll be picking people up on as they request it. We don't know what form that is. We're in the initial planning stages on that, but we're really anxious to get that started. And probably around October, November timeframe, you'll start even sooner than that, but you'll start seeing some things coming out at the MPO meetings and at this meeting too.
I guess the routes that you have, like on the east side here, people from the Lakuchi area, trying to transportate themselves to a job or something like that. So all those routes kind of match up to where that's available for people to help them.
Yes. The problem, if you didn't know, in June is 25 years of PCPT, fixed route service. The problem is that there's never been a really in-depth study on the routes and what they're serving. As an example, on the west side, Route 18 is serving a hospital. It's no longer there. They moved it. And so we need to really fix that. And we've been trying to get a study moving forward, all federally funded. It's not going to cost Pasco really anything, just some federal funds that will move that forward. We've been waiting for that to get through the procurement process. So, but that route, that study is really going to look at where are the people, where are the jobs, where are the medical appointments, where's senior centers for food, where are the daycare, adult daycare type of things that are going on, and seeing how to set up the routes to meet those needs. And it's solely fixed on fixed route because that'll drive everything else. So that's where we're at right now. And we want to address that exact same question. Are we serving the community both on the east side, west side, basically Pasco County correctly? And there will be a lot of outreach on that. It's a large chunk of the funding is for outreach. I could do, a very small outreach program, but I'd rather get everybody's opinion, both on this side, Crystal Springs, with the Palucci, Trilby area, and in Hudson, and as well as all the places in between.
I think that gets more important for the whole county, not just
it's not just a county. It's got to be for the whole county, and it's got to have a 5-year plan on it too, because as you all know, Pasco County is one of the fastest growing ones in the state. And I think we're still high in the nation too. If we're not looking 5 years out now, we're behind the curve.
And Kurt, can you talk to us a little bit about? I know we were talking about the implementation of a software, an app on our phones to be able to track. I think that'll
be coming later. That's on my update.
Oh, okay.
I have a good update for that. We'll
Okay,
get
I
to
didn't know if
there,
that was
but
covered here.
just want to stay with the AOR, and then it's coming.
Thank you.
Yes, ma'am.
Our service is back to 100% now.
Yes. Yes, we are. But the problem we're having, though, and you probably have seen the, how should I say it, help wanted signs everywhere. We are down 19 drivers. That is large. We are combining routes. We're doing everything we possibly can to keep as much service out in the roads as possible without, as you well know, fatigue plays a big role in accidents. And so we have to cut back. So we would love to have full service. If I had everybody here, we'd be doing full service. But since we're not, we're having to cut back on some of those routes, yes. And it's all out there, lots of public out there. Paratransit, we are full service. Anybody's getting it right. We're not turning anybody away on paratransit. So we're good on that.
Okay. All right. Thanks, sir.
I think you and the median, right?
Next we have the grievance procedures. We have the Pasco County Transportation Local Coordinating Board grievance policies and procedures update. The grievance procedures update for the local coordinating board, they've been reviewed by the planning agency. There's some administrative minor reviews of the dates, and there was no major changes to the grievance procedures as they were updated last year and reviewed by the planning agency staff and in accordance with the CTC. And so that'll be reviewed by the CTD and move forward.
Item C.
Next, we have the Florida Commission for the Transportation Disadvantaged Community Transportation Coordinator. Prior to organization recommendation of CTC recommendation.
And once again, Kurt Scheibel, Director, Pasco County Coordinating, CTC. We are going to need to acquire to have a signature on this, or we will lose our CTC designation. The reason why is every 5 years we have to re-up our CTC. It's a long, convoluted process that I've been learning for the first time. So we're at literally the next to last step. After this step, the signatures will go into the BCC board for the MOU signing, and we'll send it to Sherry Powers, our representative up at Tallahassee. And then she'll put it before their board at their last meeting in June, and then we'll become a CTC. So that's all our funding that Tania had before. I'll take any questions on that. Standard procedures.
See. Any questions? Okay. No questions.
And it'd be recommended. It's just and it actually says in the thing recommendation for to continue on. My next one too. Yeah, I'm the next one also, right? And the board of county commissioners also voted, I believe, the first meeting in May, to also recommend us to continue to be so. And the next one is actually the memorandum of agreement too. So that is where the signature will actually be signed. And then we'll go from there. And then I think I'm the next one on the Transportation Disadvantaged Service Plan annual update. Every year we have to do our how much money we get and how much money we spend per rate per mile. All our rates are based off of both trips and miles, but for our system, we are using the per mile amount. You should see the numbers in there. Basically, The numbers that we're looking at is 3.21 per passenger mile for ambulatory with that's 321 is the one that's important. I'm missing the other page here. I thought it printed out on the other side. It came up blank. I'm sorry. But there's both a passenger ambulatory and non-ambulatory. Those two rates are what we use and what we charge to them. The average trip length has actually increased from over this last year. We're seeing a lot more rural riders ride, and that was a big discussion both with the National Transit Database and there, and why are we having more rural riders than um, urban riders? And the only thing we could come up with is that rural riders were the only choice, whereas they might be able to get their next door neighbor. There may be a daughter, family member, somebody, son to be able to pick them up and take them where they need to go in town, whereas opposed out in the rural areas, it's a little bit more tricky to get that accomplished. That's the one thing we've been noticing. So,
Kurt,
yes.
Any thoughts about that urban versus rural as far as people using Uber and Lyft and other? They think that may have any kind of play in it.
That's also true. Also, the problem you'll get with Uber and Lyft is that the ride's not guaranteed, and ours are. Because I know folks that are around the areas that talk about, well, Uber is cheaper and Lyft is cheaper. The problem is they don't guarantee it. They can cancel the ride at any time. The other part of it, there's a lot of legal stuff that goes in there, and Uber and Lyft can change the prices at their whim. They can put a surge charge on it. And I did some research for that as part of our budget discussion through the county. And there's actually a town in Canada that went strictly Uber. And the issue is that they're more of a rural type of town. And the problem they run into is that when it's door to door, a lot more people started using it. And so they were estimating $900,000 to be the cost. They exceeded that in the first year alone. They were up to 1.2, and they even limited the number of rides people can do per month to like 20, which is, that gets me there half the time. So the first 2 weeks I can get to work, the second 2 weeks I can't. So it gets expensive after a while, and then they have to try and get people there. One of the things I've noticed is that if you remember, Tibarda has a program called UServe that they're using to be able to transport people around. One of the things is they're required to have a ride, and if they don't do the ride, Lyft was picking it up. They had to pay Lyft to do it, and Lyft costs are actually a little bit more than us. They're like $377, and ours is around $250 a mile. So, and the trip cost though was just a little bit cheaper, but the per mile cost was more, and that was only for ambulatory. Their non-ambulatory was like $55 a trip, and we're $25 around there. So there was a lot of talk about that in the budget process. And this is just to approve it so we can add it and get our trips and equipment grant moving forward. That will be on the July 6th BCC for everyone. Any other questions? You, sir.
He's off the hook now.
No, I got one more after this. But.
You serve Steve Holmes. He's on the line. Steve, are you there?
I'll just kind of go ahead and give my overall BCPT update and the trips and equipment grant because they all kind of roll into one. This year, the CTD Commission decided to redo or actually 2 years ago, they started the study and they came to a new model to allocate the money, pass out the money to each of the different CTCs throughout the state. We came out relatively okay. We lost about 20 to 30,000 compared to previous years. I consider us to be about 870 probably for a while now without much change. I can see that could, depending on how the fund fluctuates up and down and moving forward. The more concerning issue is that they're about to decide whether if anybody who lives in an ADA zone within the bus system, they will no longer fund those trips. The issue is that they feel that that is a subsidized trip by FTA. FTA pays for that trip, even with a letter that has been given back to them from the FTA saying, no, it is not a subsidized trip. They're still moving forward with this process. To give you an example, that means anybody in Dade City would no longer get a trip. We'd have to pay for it through ADA funding. Anybody in up and down the 31 corridor, anybody who lives in the Spring Hill that moves down, anybody along 54, basically about 3/4 of our people would no longer be able to get CTD trips. They'd have to do ADA trips. The problem with that is that there's a limit. Very specific rules, both pro and negative about that. And they consider a ADA trip to be anybody that drops off or picks up in ADA corridor, which is also not according to even federal or even state requirements. It's a totally different thing. Normally the start of the trip determines what type of trip it is. So if we picked up in small urban, and I charge small urban when we go to DOT, if I pick them up in rural, it goes to rural, or large urban, large urban. They don't consider that. They say it's if you drop them off or pick them up, it's an ADA subsidized trip, which is not quite true. So if that happens, then how we provide service to the county is going to change radically. I just want to make sure you're aware of it. We are working with the other agencies inside Florida on this. I am the if you didn't know, I am also the vice president for the Florida Public Transportation Association. And I'm in a lot of meetings on that. We have another one coming up. But I just want to make sure you're aware of that as I come forward. My gut feeling is that they are going to rule for that. And then we'll see what happens from there. But it's affecting, like Miami-Dade County is having major issues. Pinellas, the whole county is a urbanized area, large urbanized area. That means that all they can provide is trips for like the bus passes and things like that. There's various things on there, and there's a large, I should say, resistance to that within the different transit agencies. So we're moving forward. I will continue to provide trips, and I say we can't, and we'll go from there. But that's where the trips and equipment grant is going. Now to get to your question, Mr. Napier. I was hoping to have it out today for the new app. So we procured a system called EcoLane for our paratransit side. It is both a scheduling and a customer service enhancement for Pasco County. And we're already seeing the benefits of it. We're able to have less drivers provide more trips out there. And the big thing is there's a app. We're just trying to get the coordination to get the county account, to get the account onto the Apple and Google Play stores. That's where we're at right now. It's just got to get it on there. But here's the end result of this. If you're a client and you are being picked up, you'll get a text message saying they're on their way. And I don't know if you all done Uber or Grubhub or whatever. You click on it and you see a little car driving down the road and say, Kurt's coming to pick you up and he'll be there in X number of time. This is real world timing based off of, I don't know if you ever used Waze where it says it's traffic or non-traffic. It's based off of that. They get the traffic numbers and everything and are able to pick it out. The other feature on there is you'll be able to book your trip online whenever you want to. So you can go on there and say, log in, this is what I want to do. And on your phone too, I want to pay picked up here, dropped off here, and it'll tell you yes or no, we can do it, and then give you alternate times to be able to do that. And you do it all online, and you'll be able to get as long as you're using CTD funding, you'll be able to get it right then and there and be able to pick it up. If you have other funding sources, there will have to be a phone call back and forth to make sure we don't overbook those trips, but we can make that all happen. So that is literally, I was hoping to have it today, honest to gosh truth. We do have an aspect for that for fixed route. It's in the procurement process, and my understanding, I believe it's at the CAA office. It's been there for a little bit. I do not know when that will be coming out, but we have it also for the fixed route side too, and it is coming. And next time I'm here, I'm going to have an app, and I'm going to show you what you can do and all that good stuff, and show you the website. So we're all coming there. Yes, ma'am.
Is it accessible?
Yes, designed to be.
For folks who don't have a phone, how do they, and are in need, how do they access?
If they don't have a smartphone, they're going to have to call in. They're going to have to call in. But if they have a smartphone, and most people do, and it'll even work on the government. Everyone calls them Obama phones. It'll even work on the Obama phone. It's a free app. You can just download it. It's free, and it's right there. And then the website also will be free. If you have a computer at home, you can do it on a computer at home too. It doesn't have to be just a phone. Yes, sir.
So this is actually cycling back to what you said, where you said people who live in an ADA zone. What qualifies an ADA zone?
The ADA zone is a complex formula, but the easy thing is 3/4 a mile of any bus route. So if it's 3/4, like if you're right now, you're sitting in ADA zone because we have a bus route that goes right from outside the door. That's what considers it. There are some other nuances, but that's the big one. And it has to be in the zone on both ends. So I have to pick you up and drop you off in the zone. And it's a pickup point. It's not your house. It's if you walk down the street and you'd be picked up at the corner that's in the zone, then that's an ADA trip. The other good news is that thanks to Dave Newell and the FDOT, we just received 3 used vehicles that another agency was not utilizing. We're in the process of refurbishing that. And we also got, if you remember the briefing on 5310 money, we also have 3 vehicles on order with that also on order. And then, thank you, Commissioner Oakley, he approved us for 7 more paratransit vehicles. The problem we've been having is some people like to run into our vehicles. That's the only way to put it. And we have been really hurting for vehicles for a while, getting the funding together. And like I said, Dave's been very helpful on getting we had to jump through some hoops for the 5310 money to get it all together. And he was very instrumental on that. And we're moving forward, finally getting our fleet to where it needs to be. And because right now we're doing some of our trips in cars, and I don't like that. I like to have flexibility to be able to do it either wheelchair or no. So we're really working towards that. I believe the ones through the 5310 should be here within about a month. With the 3 that he got from the other agency, they're here now. We're just waiting to get the cameras installed, and I'm finishing that up today to get that process moving forward. And in the 7, I think we have placed the order with Creative Bus Sales. I think they have 90 days from this June 1st to get them to us. They already have the chassis in place. The reason why we're really pushing to get these earlier, the state contract ends on June 30th. It's usually 5 years. And so if you didn't know, that is a long process to redo a vehicle bid. Like a big bus is usually 9 months minimum, usually lasts a year and a half to do the procurement. And that is something that is big there. That's basically what's going. Oh, one last thing that's kind of important. PCT in Pasco County just recently went through its FTA triennial review. When I first got here back in December of 2016, we had our first one that I was at. We had 17 write-ups. I'm pleased to announce that we have 0 findings on this current one. It's not unheard of, but it is very, very rare to do that. And I'm sure Dave can talk to you about that also. And then we also have an FDOT one coming up soon. I haven't been officially notified, and they're getting close to the 45-day limit, but I know Dave will have it ready for me. And that'll be in 21st of July, if I'm not mistaken, 21st and 22nd. They'll be here for that. And I hope to be able to come back and say, again, we have some great results back on that. Other than that, any questions from the group? Questions?
Not a question, but the comment, Kurt, you and your team should be congratulated on that, because I've been through federal audits, and when they give you a 2-page list of you need to do this better. It takes some time, and it takes 3 or 4 years to finally get it to the point. So you and your team should be congratulated in
Thank you.
making sure that we're meeting all the quality expectations. And our thanks to you and your team.
And they also added at the very last moment a bunch of COVID Spending CARES Money Act questions, and trying to adapt to those is really good. It's really a team effort throughout the county. Thank you all.
Okay. Thank you, Kurt.
We have
Mr. Chairman, this is Chris Jadek from T-BARTA.
Yes, sir.
I am giving the presentation that was scheduled for user. I am the Director of Communication with T-BARTA. So if at any time you would like to put me into the agenda, I am ready and available.
Okay. Thank you.
you have control of the screen, Chris.
All right, if you're ready for me to proceed, thanks very much. Once again, let me see if we can share the screen here. Should be able to see that. Do you see my slide, the T-BARTA user slide?
Not yet.
Nope, not yet.
Let's see what happens here.
There we go.
There we
There we
go.
go.
And now you see it. Very good. All right. Once again, Chris Jadek, Communications Director with T-BARTA. Happy to provide you an update on the TD Tampa Bay regional service that we started operating in December. We are currently asking the CTD for an extension of this service. It is ongoing on a pilot project right now, which is going to expire at the end of June. Next Thursday, the CTD will meet in its business meeting and make its decision public on that. We're asking for consideration of a letter of recommendation if you indeed support this project, and I do believe the board supported it when we started last December. So I'm happy to give you a little update on where we stand. Just for those of you who may not be familiar of it, it is a partnership between USERV and T-BARTA. USERV operates a call center, coordinates the drivers. Our service began back in December of 2020, and our primary purpose is to sort of fill the gap and provide TD transportation across county lines within the 5-county T-BARTA region. And so to the north, that includes Hernando, and then of course Pinellas and Hillsborough to the south. We do not go into Polk or Sumter County, but we can provide those cross-county trips anywhere in the T-BARTA region. We also do some evening and weekend service when the local CTC is not operating. So I believe PCPT provides service weekdays maybe till 7:30. Our service on weeknights goes until 10 p.m. So we can provide in-county service and do that, but our primary purpose is really to provide that cross-county transportation that previously was not available. And very important to note that these TD services do not supplant anything provided by the local CTCs. So if someone calls us up in Pasco and they want to go to their doctor and it's somewhere within Pasco County, we refer them right to PCPT. That's not a service we provide, nor are we looking to provide. As mentioned before, we have a CTCD application pending. The money we get comes from an Innovation and Service Development Grant, and we're looking to extend that another year. The purpose is to increase a TD person's access to job training, employment, healthcare, and other life-sustaining services. So if a person gets a job in Pinellas and they live in Pasco County, we can provide them transportation for that, or if they need to go to Moffitt Cancer Center. So providing that regional connectivity is the primary reason for doing that. We want to reduce the difficulty in transporting the transportation disadvantaged population to a transportation hub and try to get them to their final destination, which is why it is a door-to-door service. So as mentioned, this is an on-demand and scheduled service. There's a call center by which people can call up as little as 2 hours in advance, but they can also schedule it as much as 30 days in advance. So ideally, we recommend if you can schedule it a couple days in advance, that's great. We'll make sure that you have the ride you need. We provide both ambulatory and wheelchair accessible rides. As mentioned before, it's direct, nonstop, and door-to-door. And the drivers are trained and credentialed by user, which is experienced in this. A little background on the outreach. There's no big public relations campaign, no marketing dollars spent toward this. We've relied on our partnerships with the CTCs to get the word out, and Kurt Scheibel and PCPT have been great in doing that in Pasco County. We have done county-specific flyers, such as the one you see here, that will spread the word. And then on our website, we also put county-specific information. This is a snip of the page from Pasco County. If you went to the tdtampabay.com, you'd see an overview of what we provide. But then as you see on the right, there are tabs for each of the counties that we serve. And if you go to the Pasco County tab, the first thing you see is where the local CTC provides service, and we provide links to PCPT service. And then we explain what we can provide within the county, because it does vary by county depending upon what the weekend and evening service might be. We do ask that our applicants apply separately. One of the questions that's come up is, if I have already applied and I'm qualified for TD service within a county, am I already qualified with your service? That's how we intended to start the service, but different counties have different requirements, and the state actually came back and asked us to have a separate application process. So the application you see here, and this is a little bit more of a close-up, really mirrors a lot of what the counties are asking to qualify someone as transportation disadvantaged. Essentially, if you qualify within the county, you're going to qualify with us, but you do have to apply. We do have the application posted on our website. For those with vision disabilities, it is Section 508 compliant, or for those who even want to print it out and send it back to us by mail, they can do that at the address located at the bottom of the screen. I want to spend most of my time remaining to tell you how the service has been received, and I will tell you it has been exceptional. You can see from the first month when we launched in December, we did a total of 70 trips. And for the most recently completed month of April, we're up to 747. So 10-fold increase just by working with the CTCs, just by that word of mouth. And you can see from the chart on the right, it shows a steady increase as well too. So very happy to see that as the word spreads, more people are using the service. And this gives you a little bit more of a breakdown as to how the service is being used by the counties. And I've highlighted Pasco County here a little bit. So total, we've done nearly 400 trips in Pasco County, starting with 6 in December. We reached a high in March of 160. That dropped off a little bit in April, but provided 131 rides in all. And it pretty much mirrors the population in our T-BARTA region. Hillsborough County does have the majority, but Pinellas and Pasco County also have a significant number of rides completed through April 30th. And while I don't have the May numbers, I expect in May we'll probably be doing even more than 747 rides. This gives you a little bit closer look at the trips by purpose. And to help you understand some of that, I'll pull some of that out a little bit. We don't ask a person, we don't determine your eligibility for a ride based on your purpose. Where you want to go, what you want to do, that's the individual's choice. So if a person wants to use it for a social trip and it qualifies as a cross-county trip, they would qualify for the ride. But most of our people are actually using it. More than 50% will use it either for employment reasons, they're going to jobs, or they have medical appointments, they're outside of the county. Another 10% are using it for school. And we've seen that start to pick up, especially as we pull out of COVID and people start to resume activities. We still see more people. You can see in the first month, nobody on trips by purpose used the service for going to school, but actually in April, 85 did. So there's a steady increase in people who are using it for education purposes as well. And then we want to break it out trips by type. As mentioned before, our primary purpose is cross-county trips. 72% of the rides we provided did cross those county lines. 31% were in the evening, and 21% qualified as weekend rides. Of course, those numbers add up to more than 100%. And it's understandable. If you schedule a ride on a Saturday and you cross county lines, you're going to be in both of those categories. So the point I want to make is that I think that the service, from where we started, we didn't know what the results would be. We certainly had high expectations. I would say the fact that we have this steady increase in this 6-month pilot project leads us to go back to the CTD and ask them for an extension on this. We've had a number of people who have expressed their appreciation for us in providing this and opening up these new opportunities for them as well. As mentioned, our request today is a letter of support for continued TD Tampa Bay service. The CTD business meeting at which that decision will be announced is next Thursday, June 3rd. I know that's coming up pretty quick, but it's not too late if it is possible to get a letter out. I believe I just saw a letter from Steve Dietz in Hernando County providing that letter of support as well. And certainly, if I think the CTD knows that if we have the support at the local level and they understand that we are complementing what the local CTCs do, not doing something in addition to or certainly in replacement of, we will get that support. Here's some contact information on the screen. Once again, I am the second Chris on that list. I'm Chris Jadek, Director of Communications. Our project manager is Christy Anuntis. I believe he may have presented to you earlier this year. Brian Pissarro also works with us as the principal planner. And Steve Holmes, who was alluded to before, is our partner with User. That's his information right there. With that, that concludes my presentation. I'm going to stop sharing here, and I'm open to any questions you might have.
Any questions from the board? No. Everybody seems to be satisfied.
Well, I do appreciate it. I appreciate the chance to get into the meeting. Sorry we had a little delay there at the beginning, but it all worked out well. So thanks for this opportunity.
Thank you. Okay.
That's the end of the meeting, Commissioner Oakley.
I can't hear you.
That's the end of the meeting.
I can't hear you from.
We can adjourn.
Oh, we can adjourn. Nothing. Everything's covered.
We don't have.
One thing I like to say, we need to reach out to all our members, and we appreciate for everybody that comes. But do we have alternates for everybody that are here that would come in their place, just so we can have action? Because we need to make actions when we have these meetings. So it's very important, and I know Kurt needs to be able to go forward with things that he brings to us.
Once again, Kurt Scheibel. I will say the May meeting is probably the most important meeting to attend. That is usually when I have my trips equipment grant coming up, and the rate model will always come up at that time. So encourage everyone on that, and I will reach out to some of the folks too and see if we can get more people in here, because again, we have to take action on these things. Unfortunately, we're going to have to sign some things that have to be signed or the funding stops.
Right.
And that's how important it is.
Yeah.
So we'll move forward on that. And it's a recommendation for the board. Recommendation is the only one he has to really sign.
So is it a part of our membership that we have alternates, and those alternates are voting alternates that can come into place of us? We need to reach out and make sure that if you can't be here, we understand that. People's time is important, but it's also important if we're going to have these meetings and be able to take action. So we need to reach out and make sure we have a quorum every time. So
I guess get clarification because I was a little bit confused as far as we continue to call these hybrid meetings and need in person to have quorum versus people on the line to be quorum. Just clarify that for me, where we're at right now as far as if we had 3 or 4 more people on.
If they were online, we would have a quorum.
No, we
Oh,
do
they
have
have to be in person.
you have to have, in order to have quorum, we have to have our board is 16, so we need 8 plus 1. We need 9 to have quorum. We need a physical quorum per what the governor said, per what we are in the COVID regulations.
That's what I thought.
Yes, we have to have a physical quorum, so it's still a hybrid virtual stance. But now we're starting to come, the COVID restrictions are easing, so we're slowly going back to a more normal stance. We're opening the doors to the public for our board meetings, and so the public can attend. And so we are, like I said, it's advised that we now are starting to come to the meetings face to face. So especially for the local coordinating board, we must be in attendance because our action items, we have to vote on them in order for the planning agency to receive the funding. So today, unfortunately, we lost funding because we couldn't take action on the 5 items. So, and especially as Kurt had said, for his rate model and things of that nature, we have to be here to vote, trips and equipment grant and so forth. So it is very imperative, especially with the local coordinating board, action items are very dependent on the grant funding. Every grant is different. For those of us that has worked with grants for a very long time, they all have their nuances, and this is one of them. So I urge us, I know we've been in a very different stance over the last 15 months. We've been in our homes. We've been in coffee shops, we've been everywhere, but in our regular work environment. So it will take us some time to get back in a regular format, but we have to get back into the swing of things. Otherwise, we can't take action and move forth with the way we should be going.
And the only difference when you have to have the quorum present, but then you have members on Zoom, so you can't take a motion
Right.
just by aye or nay. You have to have roll call vote because you have some members that are not here. They have to be recording their votes. So.
Because we can't have somebody
Yeah.
voting off, on the beaches of,
Mhm.
wonderful Bahamas or something like that. We have to have, either, and you have to be in person or to make that vote. Online is a great way to participate. However, the vote has to be in person.
On the VOC, you have to have a quorum, which is 3 out of the 5 of us. And then if one member's not present, you have to have roll call vote all the time. So then also if I never realized this before, you always have to have a quorum in a board meeting or VOCC. You always have to have a quorum sitting at the dais when action is being taken or people are hearing reports. You can't leave just 2 people here. You had to go to the restroom and excuse yourself. You can't leave it with just 2 people. You'd have to recess. So it's very particular about having a quorum at the dais so you can take action and everybody hears what's going on. So it's very important to have a quorum. So we have enough members if we could have alternates that they'd sure make it great if they could push that person to come. So
first 90 days of COVID, I think we were virtual and we didn't take any action. We were all just in a virtual stance. And then the governor created a hybrid virtual stance. And now I think by July 1st, I think that stance is going to go away. So we have to somehow transition ourselves over the next few months.
And so, I think in this meeting, you actually could have 18 people here today from the public.
Yeah.
18 here. Over in the west side, you could have 30. It's a bigger room and things like that. So you got 30 people.
Big's coming up.
Well, every time
Depends on
there
the
is
item.
something big.
It depends on the item. You might have 100. You don't know.
Let me give you an example. We had 81 emails last meeting. 40 of them were pretty much the same email except different names. So based on our attorney, we were able to read all the names on that particular email and then read that email into the record. But the other 40, we had to read individually. If you take 40 of them and they all have 3 minutes, that's 2 hours worth of reading. We need to get
In
back
person.
Right. We are taking up time. Yeah. I walked into
So
the
next month or so, you'll see some more changes back to normal. I think you'll probably see these shields go down and things of that nature. So we'll be back to normal. Most people are vaccinated, thanks to Mike and his team and a lot working in Pasco. Done a good job in getting us through that crisis we had in our community. Really appreciate that.
Right. So I sit on several of these boards. Most counties, I believe, have amended their agreements so that they can have a hybrid, but with 5 people present. Simply because many agencies, mine included, we're not allowing people to go out, even if the governor said everything's back open to business. The agency head was saying, I do not want my people in the public yet. And so they just were not able to meet those quorums. I think many counties have amended their own personal plan, or as long as there's an emergency order kind of out, that they're okay with 5 people in present and the rest virtual. So that might be something maybe you want to look at when we do have a quorum, because it is a
yeah, we would need to have a quorum to amend that.
Yeah.
I'm completely on board, and that was something we were looking at, but we still need a quorum to amend.
Yeah.
Well, it's important for all the agencies to be present and represented, but we may need to look into that because there's many times we don't have time to take action. It's very important for our county.
And that is definitely as the local coordinating board that is within your jurisdiction to say, hey, we have 16, we want to definitely scale this back. But again, we would need quorum to make that happen. So if online, for those who are participating, if you'd like to come in and make that part of our next agenda on August 26th, to change our bylaws to scale down our quorum requirement, that is something we can do. If we can have the commitment to do that, we can definitely work on that. But we have to have quorum to do that. We have to have quorum to change the things that we want to change. We went through this with the Citizens Advisory Committee, with the MPO, with the TAC, and I understand we have to get back into the swing of things. That is part of it too. And like I said, that stands for so long. Now we have to kind of move forward. So there's that component. So like I said, I just urge everyone to participate. I understand you have to do what makes you feel safe. You have to still be safe, so we understand that as well. So.
The only problem I see in that is that would be reducing members of this board.
It's tricky.
I would feel like they're all very important to this board. So it's hard to reduce them when they need to be a part of it.
And it's not to say they're not a part of it. It's just to say the smaller group can then make a decision for the rest.
So let's look into that and bring that back.
Okay.
Next time we meet. Okay.
All right. No problem.
All right. With that, we'll adjourn. Good seeing you.